Welcome to Speak Now at 95.7 FM WELT, connecting communities across the globe. I'm Gena, and my co-host today is Tamara, registered nurse for the last 19 years with the experience in occupational health, behavioral health, and she's also a mental health counselor. She also works as a youth mentor and advocate. Welcome, Tamara.
Thank you for having me.
Okay. Our focus today is mental health care with the African American population in mind, and we're going to be talking with Dr. Sarah Y. Vinson. I'm going to read her bio. Dr. Vinson is a child, an adolescent, an adult, and forensic psychiatrist based in Atlanta, Georgia. She is an assistant professor of psychiatry at Morehouse School of Medicine and an adjunct faculty of child and adolescent and forensic psychiatry at Emory University. She is a founder and editor of the culturally tailored psychoeducational website blackmentalhealthnet.com. She's worked in a wide variety of mental health treatment settings. She currently serves as the trustee at large and advocacy liaison for the Georgia Council on Child and Adolescent Psychiatry. She's been a speaker at national conferences, including the American Psychiatric Association annual meeting, the American Academy of Child and Adolescent Psychiatry annual meeting, and the Black Psychiatrist of America Transcultural Conference. She's received numerous awards from her medical school, the APA, and AACAP in recognition for her service and leadership. Thank you and welcome, Dr. Vinson.
Thank you for having me.
I would like to extend a welcome to the listening audience as we delve into forensic psychiatry. Dr. Vinson, can you start off by sharing your journey to psychiatry?
Yeah, so it was one that I honestly did not see coming, but in retrospect, it makes perfect sense. I started medical school with an interest in adolescence and thought I was going to be a pediatrician. But then as I went through medical school and started learning about things like the neurobiology of addiction and trauma and how culture relates to mental health and expressions of mental illness, I got really interested in psychiatry. And the way that I say it is it kind of chose me, because by the time I finished medical school, I really couldn't imagine doing anything else. And I absolutely love it. And then, looking back, I was that kid who loved to read people's autobiographies. And really, psychiatry is about people's stories in a lot of ways. And so it makes sense now. And I saw ways where psychiatry really, in terms of the fields of medicine, is one that needs advocates in a way and sort of cultural ambassadors to help people understand its relevance in minority communities and specifically in the Black community. And so that was something that drew me to it as well.
And what about forensic psychiatry? How did that come into play?
So with forensics, I was one of those kids who wanted to either be a doctor or a civil rights attorney or a sports anchor. Since I ended up in medicine and then psychiatry, forensic ended up making sense. And, the reality is that for a lot of people, not just people of color, but people who don't have resources, the correctional system ends up being the default mental health system for that population of people. Mm-hmm. So for somebody with an interest in underserved populations and in minority populations, as I am, and of course, mass incarceration has disproportionately, in fact, impacted Black communities. Through forensics, you're able to serve, and I do direct patient treatment in a correctional facility, a child one, but you're also able to do evaluations in the course of court cases and able to do them hopefully with a culturally informed lens that will allow you to kind of best represent what's going on in the case.
How long forensic psychiatry, that's a new field that I'm just learning about. How long has that been in existence? Is that a new field study?
Well, It's not new per se, but I will say it may be being branded differently. So the courts have always had questions about, did this person know what they were doing? Did they mean to do it? That sort of stuff.
Yes.
And that is forensic psychiatry. Anytime they can use the expertise or experience of a psychiatrist to help them understand what happened in a case, that's forensics.
Dr. Vinson, I saw that you had the experience with the biopsychosocial therapy. Can you explain what your approach is to that?
Sure. So when we think about really any sort of medical issue, but certainly with mental illness, it's helpful to think about it in terms of biology, psychology, and social issues. Mm-hmm. There is more of a push in medicine to think about structural issues as well, but that's not always as routinely sort of folded into things. But with biology, you're thinking more about sort of how you're wired, genetic vulnerabilities, medications, perhaps medical problems that may be causing psychiatric or psychological symptoms. With psychology, you're thinking about how that person views themselves, the ways that they cope with stressors, the way that they think about things, the way that they ask for help or don't ask for help, perhaps. Mm-hmm. And then socially, you're looking at the things around them that could either be helping them or that may be potential stressors or things that are getting in their way. So things like family relationships, supports for kids in school, their environment there, since they spend so many of their waking hours there. For adults, maybe things like their work environment. And then if you wanted to add in the structural piece, it's adding that layer of thinking about societal systems and how they may perpetuate or promote mental health or mental illness.
So do you have a specific approach to that? Because it sounds like it's including everybody's system.
That's absolutely the goal. And so, when I see patients for the first time, I tell them, this is going to be a long visit today. This will be longer than the rest of them because we do try to go through and ask about things like, how are you sleeping? What are you eating? Who's around you? What's the best part of your day? What's a typical day like? Mm-hmm. And so, you do kind of walk through trying to get a picture of that person's life. And of course, over time, you'll learn more and you're not going to learn everything in the first visit. But those are all things that, I try to keep in mind when I'm working with folks.
Right. And as we talk about that, I'm going to skip to a question I had for later. But since we're talking about whole health, I wanted to know what your thought is on the faith community and including that spiritual portion with the psychosocial and biology part of it.
Oh, absolutely. The faith community can be a very powerful force for mental well-being and mental health promotion. And, it's something that I've seen, that I've experienced myself. And also you have studies, like scientific studies that bear it out, that in general, having a faith community and participating in it improves people's mental well-being, improves their coping, improves their ability to sort of get through hard times and not get hopeless. And you actually even see what's called a dose-response relationship, where the more you go or the more involved you are, the more beneficial it is. Okay. So absolutely. And so for people who have who identify with the belief system, that's certainly something that we talk about in the course of treatment. And sometimes for my patients who have known that was helpful for them before and they maybe stop engaging to the same degree, I'll certainly bring that back up to them as something that, maybe we should revisit or think about re-engaging with, because we know that it's worked for you in the past.
Right. Mm-hmm. Do you have any thoughts on how the faith community can approach the idea of mental health education and awareness?
Yeah, I think on my end, I will say that I have certainly seen an increased willingness to talk about mental health issues in the faith community, which I think is great. Because a lot of people, especially people of color, that's going to be the first place they go. Mm-hmm. And so having even just mental health awareness days or discussions at church, I think lets people know it's okay to do both, and that it's not an either or, and that you can go to church and pray and go to therapy and talk. And it's fine to do both of those things. And so I do see where, to me, there does seem to be a movement in the right direction in terms of churches being open and willing to talk about mental health issues in those terms too, and not just, couching it as like a moral failure or a faith failure, but, recognizing it for what it is.
Can you talk a little bit about your experiences and your observations with people of color when discussing mental illness?
Yeah, and so, I don't want to put everybody in a box, but there
Right.
are things that I see come up a lot, and they make sense in the social and the cultural context, of course. So, I remember when I was growing up, my parents would always say, you have to be better, right? Like, you're a Black person in America. You can't just be okay. You can't just be good. You have to be great. And I know that is a pressure that a lot of us feel because of the marginalization, because of how Black people are depicted, that you really don't have as much room for error as other people do. And not just how we feel, but it's the reality. And so something that is as stigmatizing as mental illness, on top of already being a part of a marginalized and mischaracterized group, can feel really threatening. One, because you don't want another mark against you, but two, the acceptance of your community is really important if you fear being rejected by the larger society. And so having a mental illness is still, even though I think we're moving in the right direction, but it still can be very stigmatizing. So it can be hard for people to think of themselves as someone who has a mental health problem, and not be afraid of what that may mean for them, socially.
Right.
And I think the other piece of it is a lot of times coping in our communities is about, being strong and bearing through it and being blessed and highly favored and being the strong Black woman, the strong Black man,
Right.
Which doesn't lend itself to being honest about those very human, universal experiences when you are vulnerable, when you are having a hard day. And so that inability to talk candidly about the hard times, I think sometimes will result in it coming out in different ways. And so part of the conversations that I often have with Black families are around, how this has biological bases, just like diabetes and hypertension do, how this is treatable and how this is not, a moral failing or a lack of, willpower or character.
Now, with the thought of other cultures, how have you addressed other cultures to be more sensitive to the Black culture when we do experience different ideas and uprearing? How do you approach those environments?
Yeah, so I try to have really, candid conversations with people about how different the experience of being in this country is for people who aren't white. And sometimes people can receive that and sometimes they can't. But what I try to encourage them to do is take what we call a stance of cultural humility. So I'm not trying to teach them Black people do this, Asian people do this, Hispanic people do this, but just saying, understand that their experience within their family, within their culture, within this country may be really different than yours. And so it's important to ask about it and to be receptive to what they're telling you about what their experience is. I've heard a lot of well-intentioned, white clinicians say, well, we're all the same and we're all human. And my response to that is, unless you've sat down with a person of color and really tried to understand what their experience is, what you're basically saying is we're all like white people, because you don't know what it's like to be Black in this country unless you've actually taken the time to figure that out and to understand it. And I do think that we're getting more diverse within the mental health field for sure. But we're still only looking at 2 to 3% of psychologists and psychiatrists that are African American. And so I think you do see people sort of trying to push that conversation. But unfortunately, we still have a ways to go within our mental health professionals.
And I do agree with that. And that was going to be a thought or a question as well. Because I've had experience where young people have said that they have a hard time sharing and expressing themselves when the therapist or professional does not look like them.
Yeah.
So can you speak to that? And that is prevalent in this area that I'm from. I don't know how prevalent it is in the southern states, but I've had children say that to me.
Absolutely. I mean, Atlanta's Atlanta is different because you have, the AUC Center, you have Morehouse School of Medicine, you have a lot of people who went to undergrad in the AUC and stayed here. So Atlanta is like the closest thing to HBCU for grownups that you're going to get, frankly. So you actually have a lot of Black professionals and a lot of Black therapists here. But I know this is the exception. I will say, I think that why people say that is because the presumption is if they look like me, they'll understand more of my experiences, which may be true and which may not be true. You know, if somebody grew up in a suburb in Virginia versus rural Mississippi, like there may be a lot of ways their experiences don't overlap.
Right.
And so I would encourage folks in areas where that may not be an option, because it isn't always an option, to instead look for someone who you feel is really making an effort to understand your experience. Because I do think that there are people who can be effective, who can help you, who may not look like you, but who are able to listen and try to understand where you're coming from. And if that person doesn't do that, go to somebody else, but don't forego therapy altogether because you can't find somebody who's the same background.
Right.
How can we address, as people of color, even our own cultural misconceptions, and as well as white people?
Yeah, and that's definitely true that internalized racism can be an issue. And, you know, even internalized Islamophobia or internalized homophobia, right? Yes. So it always is going to take sort of being open and trying to take a non-defensive stance when it comes to things. You know, I also think it's helpful to think about the larger societal context of things, because then people may not feel as personally implicated if they understand that you're kind of primed to think in certain ways based on how things are covered and how things are talked about. So this is part of what we'll talk about when I come to Indiana to do the training, is how there are all these messages about the inferiority of Black people that you start getting very early. Right. You know, they just not too long ago, the doll experiment was repeated and you got the same results, right? So you get these messages, we all get these messages. And so it's not a matter of you choosing to be a racist person. You're in a soil that grows racism, right, and that does it in a very intentional and systematic and wide spreading way. And so I think having some understanding of that and appreciation of that can sometimes help people not take it as personally, and in so doing, help them not be as defensive and hopefully be open to acknowledging the biases they may have and trying to work to actively combat them.
How I want to move to how is mental illness masked, even in the Black community, in the school system. We talked about the churches, and perhaps in our homes, in our own homes. Yeah, so sometimes people may not even recognize it as mental illness. And so it's not as if they're saying, I'm depressed and let me hide it. They know they don't feel right and they're doing something to kind of help them get through it. And that may end up being what the mask is. And, you know, I'll give an example. Like in my community, in my family, I saw where substance use had affected people. But it was always kind of framed as, you know, they make bad choices or in that sort of language. And when I went to medical school and learned about, you know, the neurobiology of drug addiction and how it was actually something that people could inherit in terms of being vulnerable to it, I had a new way of thinking about it. Like I had a new way to conceptualize it. And like for the first time, I thought of it as like a medical condition and a mental illness. Well, you know, a lot of people don't go to medical school. And so right. I think there still is a lot of education around like how we think about these things and recognizing things for what they are. So, you know, I've seen people who were depressed clearly, but said, but I wake up and I go to work every day. And that's not what a depressed person looks like. Right. And so sometimes people just don't recognize it. It's not so much a matter of them trying to hide it or masking it. They don't know that's what it is. Okay. And so I think that would be one thing to bring up. You know, the other thing is you do see people, what we call self-medicating, just basically where they use something that helps them feel better in the moment, even if it's not something that is best for them long term. So, for instance, I work at a juvenile justice facility. It's mostly Black, traumatized young men from under-resourced communities, stressed out family households, those sorts of things. And probably 90% of the boys there have been using marijuana every day since the time they were 13 or 14 years old. Now, they don't recognize this as I have psychological symptoms from all the trauma I've experienced, and so I'm using marijuana. But they will say, you know, marijuana helps me sleep. And that's why they can't sleep when they come into the facility. Or they will say, when I ask them, you know, what do you do when you're stressed or you're mad at home? They say, I smoke.
So they don't see it as an illness they're trying to treat, but that's what it is, because their brains, how they think about things, have been impacted by all the traumas that they've been exposed to throughout their lives. And so sometimes it may be substances that mask it. And, the family may be arguing with them about marijuana, but may not realize what that marijuana is doing for them, or giving them another way to deal with what they're using the marijuana to deal with.
And what are some of the ways that you suggest that we encourage young people, especially, to deal with their stressors or their depression or even low self-esteem as they're growing up?
Go ahead.
I'm sorry. It sounds like what you're saying, and I'm sure you've already heard about the ACEs, the adverse childhood experiences. Some of what you already said are some of those things with ACEs. So what are your suggestions on how we encourage young people to deal with or cope with their stressors, their depression, and what have you?
Well, honestly, I think it starts with modeling. Because we can say a whole lot of things to young people, but at the end of the day, they're going to watch what you do.
Right.
And so if the adults around them aren't able to acknowledge negative feelings and deal with them in a healthy way, or tell them to just man up when they try to have an honest conversation about when they have a hard day, all that other stuff isn't going to matter.
Okay.
And I think that a lot of times the adults aren't giving good examples of how to navigate things, not necessarily because they want to give bad examples, but they may not know any better themselves, or they may not have better tools themselves. And so if you are yelling at the kid about yelling in class and yelling at his brother, it's probably not going to work, because even though you're saying don't yell, you're showing him you're upset or frustrated. This is an acceptable way to deal with it.
Right.
And so I think modeling is number one, giving the kids space to talk about their experience. I've also seen that what can happen sometimes is it's hard for parents who care about young people to sort of sit with the fact that those young people are having trouble, or sit with the fact that they're having some sort of negative experience. They want to just tell them, well, be positive, or get over it, or deal with it, right? And those are good, and you want to do that, but kids also need to feel understood, and they need to feel as if it's okay to express their feelings, and that somebody cares about their feelings.
Right.
If a kid is angry, instead of yelling at him about how he's choosing to express that anger, first try to understand what they're angry about. Then you can have the conversation about how they express it, and they're going to be a whole lot more receptive to it then than they will at the beginning if they don't feel understood first.
Okay. Do you incorporate physical activity in your treatment or therapy?
I encourage people to exercise all the time. I'm someone who finds it very beneficial for my own mental well-being. I don't always convince people to take me up on that. But it's something that I try to get everybody to do, from my kids to my adults.
Okay.
And the ones that I am able to get to start doing it, it becomes reinforcing by itself, because they end up seeing that it is beneficial.
Right.
But it's one of those things where I can't make them do push-ups in session or something. But I try to find something that's physical that they're into, and encourage them to do it, and help them understand it's helpful for depression symptoms. It's helpful for anxiety symptoms. It's helpful for ADHD symptoms. It's helpful for your sleep. And it's no side effects, only good things come out of it. So yeah, I'm a big proponent of exercise, and think that it can be tremendously helpful for people.
Awesome.
Thank you.
One of the things I've read over and over again while researching you and your practice is that you speak a lot about mental wellness as much as mental health. And that's a positive thing. Can you speak to that preventative measures? You have spoke to it as far as exercising. What else can we look at as a people, period, not just Black people, but as a people, period, to talk about wellness and incorporate that into our mental health?
Well, I think for me, I see it as part of the strategy to destigmatize and demystify mental illness, because if we say the mentally ill people over there, and the people who are fine over here like me, it's easy not to understand when you might be slipping toward a mental health problem or a mental illness. And so I almost always start off talking about this continuum, that everybody is on a continuum between mental health and mental illness.
Yes.
And everybody can slide up or down that continuum depending on what's going on in their life, what their stressors are, and what they have on deck to sort of cope with those things. And so I think any discussion about mental illness is a discussion about mental health. And we always have to bring those two together because they are part of the same continuum. I really try to push back against that false dichotomy of mentally healthy and mentally ill, like continuum.
Right.
And so I think once people realize that they're vulnerable, because we're all vulnerable,
Yes.
you'll be more motivated to do things that are what I call mental health preservation sorts of things, right? So I have seen people who are very intelligent, who were very successful, who had a lot of things going for them, who end up with severe mental health problems. And so being someone who's seen that firsthand, I have an appreciation for the fact that there isn't something that's necessarily going to protect you, and that it is something that you have to actively try to cultivate in terms of mental well-being. And so, for instance, there are times when if I know I'm working on a really tough case or a really difficult case, I know not to schedule anything when I get back, or I try to regularly schedule vacations, not when I need them, but before I need them. So every few months, try to get away and take a few steps back. Even things like, people who may drink socially, that you make it a point not to drink if you're having a tough day or a bad day, because you realize you're on that continuum and you don't want to go from social drinker to somebody who's looking forward to wine at the end of the day to help them with coping. So I think that the first part is that awareness that we're all of us on the continuum, and thinking about prioritizing those things that we know help us function our best. My experience is that most people know what helps them feel good. Right. Most people know what helps them function optimally, but they somehow decide that other things are more important to emphasize or to prioritize. And so, I encourage people to think about those things, because most people have an idea of what they are, but really guard those things that promote your own mental well-being.
Mm-hmm. Very nice. Well, Tamara, do you have any other questions? I've covered just about everything.
I think we've been well informed. And yes. I have one more question. What are your thoughts? You said that this profession or career chose you. Unexpectedly. So what are your thoughts on encouraging this profession to young people? Or anybody that's going back to school?
Yeah, good question.
Yeah, I mean, come back to school and do it. Absolutely. So I honestly believe I have the best job in the world. I love what I do. If you can't tell, it's really very interesting to me. It's challenging, but also you get to, sit across from people and sit with people at really pivotal times. And I have some people that ask, well, how can you do this? How can you listen to these things? And my response is that I also get to see people as they recover. I get to see people move forward with their lives, or get back to themselves, or say, I have my daughter back, or say, I feel like I have a second chance at life at 42 years old. And that's the sort of thing that is so incredibly rewarding. And I'll say the other thing about this work, too, is I don't think that you can be good at it without growing as a person yourself.
Yes.
Okay.
And so that's a really cool aspect of it too.
All right.
Very nice. Dr. Vinson, I thank you so much for your time. I'd like to leave you with the final thought.
Go exercise.
Go exercise.
Yeah. Thank you so much.
All right.
All right. You've been listening to Speak Now at 95.7 FM WELT.